Welcome to Memory Day at the Missouri State Capitol. If you know 3 facts about Alzheimer's, you probably know 3 more facts than many legislators. Alzheimer's is an epidemic. In the United States, over 5 million Americans are living with Alzheimer's, and another person develops the disease every 66 seconds. It is the 6th leading cause of death in the U.S. In 2017, Alzheimer's and other dementias will cost the nation $259 billion. State facts are important. In Missouri, 110,000 people have Alzheimer's, and that number will grow to 130,000 by 2025. There are more than 300,000 Alzheimer's caregivers in our state. If you put a dollar value on the unpaid care they provide, it is more than $4 billion. A quick review of today's Memory Day schedule. At 11 a.m., buses arrive at the Capitol. From 11 to 2, groups will visit with their legislators. 11:45 to 1:30, you can find box lunches on the second floor. From 2 to 2:25, the Memory Day ceremony will occur in the first floor rotunda. At 2:30, there will be a group photo on the South Capitol steps. And at 2:45 p.m., buses will depart for the day from the Capitol. In the Missouri legislature, the Republicans have a supermajority, meaning they hold all the key leadership positions, including chairing all of the committees. Before we talk about our 2 legislative priorities for the day, let's cover a few tips on making a successful legislative visit. State your name, where you are from, and that you are a constituent. Make your ask up front. Briefly share your personal story and connect your story to the ask. Use the handout when making your pitch. Close by asking the legislator for their support. Take a photo. Send a thank you. Remember, stay on message and close by asking for their support. This year, we have 2 legislative asks. Both of our asks this year support families caring for a loved one at home. Fund Alzheimer's grants that provide respite assistance to Missouri families. $450,000 in the budget for the Department of Health and Senior Services, HB 10. And second, pass the Structured Family Caregiver Act that would offer a new option under Medicaid to receive care at home from a family member. HB 1885, sponsored by Representative Kurt Barr from St. Charles County. Alzheimer's is a long and costly disease, and caregivers need support. 110,000 people in Missouri have Alzheimer's. The disease trajectory is lengthy, spanning 8 to 20 years. Individuals will require steadily increasing assistance with their activities of daily living. Caregiving is stressful, physically, mentally, and financially. Our ask is for $450,000 for Alzheimer's grants for respite. This is not an increase from this year's funding level. State funds provide respite assistance to help families caring for a loved one at home. 70% of people with Alzheimer's are living at home because of the support families provide. The value of unpaid support provided by these Missouri families is more than $4 billion, and families cannot do it alone. Alzheimer's Respite Assistance Program offers choice and flexibility to families caring for a loved one at home. Families select the care that best meets their needs. Respite, including home care, adult day services, short-term respite at a residential care facility, or supplies, incontinence or nutritional supplies. Families are also connected to services at no cost to the person or to the state. These services include support groups, educational classes, and the helpline. Respite is available across the state. Priority is given to those in greatest need. Respite assistance could save the state millions. Delaying nursing home placement for just 2 months could save the state more than $2 million in Medicaid nursing home costs. 99% of families surveyed stated that respite assistance helped them keep their loved one at home, delaying or preventing the move to a nursing home. This is how that works. $152 is the average daily Medicaid rate for a nursing home from 2017. Multiply that times 500 families that could be in the respite program when fully funded. Multiply that times 2 months or 60 days. Take 60% of that cost. The 60% is the number of nursing home residents on Medicaid. That equals more than $2 million in cost savings. On the upcoming slides, we will review the key decision makers for Alzheimer's grant funding. These are the 3 committees responsible for the budget recommendations that must be passed by both the House and Senate before the end of the session. The House Appropriations Committee for Health, Mental Health, and Social Services is the first committee to make recommendations on HB 10 that includes Alzheimer's grants for respite. This committee has already voted to recommend full funding for Alzheimer's grants. If you visit with one of these committee members, thank them for their support. Recommendations are now before the Budget Committee. If you meet with one of these representatives, urge their support for Alzheimer's grants for respite in HB 10. At the same time that the budget is being addressed in the House, the Senate Appropriations Committee is also debating the budget. If you meet with one of these senators, urge their support to fully fund Alzheimer's grants for respite. Our second ask is support for Structured Family Caregiver, HB 1885, sponsored by Representative Barr. Structured Family Caregiver would offer a new option under Medicaid to receive care at home from a family member. Care would be provided through a working partnership between the in-home caregiver and the administering in-home agency. An agency would administer the program and provide professional support to the caregiver and care recipient. The full-time caregiver would receive a daily stipend while they provide care for their loved one's personal needs. To qualify for structured family caregiver, the care recipient must qualify for Medicaid. They must have a monthly income of $1,311 or less and limited assets. They must require nursing home level care. As a pilot, the program will be limited to 300 care recipients. The caregiver must live full-time with the person needing services and provide for their personal care needs. The in-home agency administering the program must provide professional support with care planning, caregiver training, monthly visits, and remote consultation. Structured family caregiver is important to families caring for a loved one at home. It relieves financial hardship. Family caregivers often leave the workplace to care full-time for a person with dementia, leading to financial hardship. The stipend can provide some relief. It provides much-needed flexibility. People with dementia may need support at irregular times, such as morning, late afternoon, and bedtime. In-home agencies are often unable to offer such a flexible schedule. Full-time caregivers can be there when their loved one needs them most. Additionally, it helps people with dementia feel at ease at home. In-home aides may be perceived by a person with dementia as strangers, which can trigger agitated behavior. Because care is provided by a familiar person, family caregivers can help people with dementia feel at ease in their own home. It's a cost-effective option. Nursing home care is expensive. Structured family caregiver is a cost-effective alternative and has been successful in other states. Based on data from other states, the Alzheimer's Association estimates the cost of structured family caregiver to be about half the cost of care in a nursing home, saving the state money. The House Health and Mental Health Policy Committee recently heard public testimony on Structured Family Caregiver Act, HB 1885. The Alzheimer's Association testified in support. If you are meeting with a member of this committee, it is important to urge their support for this important legislation. Members include those on this slide. The following are examples of questions you may receive from legislators. Please remember, if you do not know the answer, that is okay. Let your elected official know you will have a public policy staff member follow up and let us know. The following are a few questions you may receive about Alzheimer's grants for respite. R is representative. AA is Alzheimer's advocate. I serve on the budget committee. Remind me, what is the appropriations request and what is it used for? We are asking for $450,000 for respite assistance. These funds support families caring for a loved one at home that has Alzheimer's or a related dementia. Families use the funds for respite, brief time off, or for products such as incontinence supplies. You mentioned that this respite program can save the state money. Please explain that to me. 99% of the families in this program stated in a recent survey that respite helped them keep their loved one at home and delayed nursing home placement. If nursing home placement was delayed by just 2 months, the state would save over $2 million in Medicaid nursing home costs. I don't serve on the budget committee, so I can't help you with this request. Representative, we ask that you talk with your colleagues that serve on the appropriations and budget committees. Let them know how important this program is to the families in your district and urge their support. The state of Missouri is asked to pay for a lot of programs. So tell me, what is the Alzheimer's Association doing to cover program costs? 95% of our chapter's budget comes from non-governmental sources, the majority from individual donations. State funding provides respite assistance. Other non-governmental funding provides additional services including the 24/7 helpline, educational classes, and support groups. These services are offered at no cost to families and no cost to the state. Explain to me how this Structured Family Caregiver program would work. Structured Family Caregiver would offer a new option under Medicaid to receive care at home from a family member or other full-time caregiver. Care would be provided through a working partnership between the in-home caregiver and the administering agency. An agency would administer the program and provide professional support to the caregiver and care recipient. The full-time caregiver would receive a daily stipend while they provide care for their loved one's personal needs. We have in-home agencies with trained aides that provide these services under Medicaid. Why is this needed? Representative, families caring for a person with Alzheimer's often leave the workforce to care full-time for their loved one, leading to financial hardship. The stipend can provide them with some financial relief. Additionally, people with dementia may need support at irregular times, such as morning, late afternoon, and bedtime. In-home agencies are often unable to offer such a flexible schedule, and a full-time caregiver can be there when their loved one needs them the most. I have real concern with the current growing cost of Medicaid. This is not the time to offer a new program idea. Representative, all of the people in this program qualify for nursing home care, and that care is expensive. Structured Family Caregiver is a cost-effective alternative and has been successful in other states. Based on data from other states, the Alzheimer's Association estimates the cost of Structured Family Caregiver to be about half the cost of care in a nursing home, saving the state money. The program is also being proposed as a pilot with a maximum of 300 care recipients. I sure would like more information about how this in-home agency / family caregiver partnership works in other states. What can you tell me? Representative, I am a volunteer with the Alzheimer's Association and don't have the answer today. I will make sure you get that answer and will ask the public policy staff to follow up with you. I have a constituent newsletter and also have a Facebook page. Would it be possible to get a copy of your photograph to post about our visit? We would be honored to have you include the photograph. I will email you a copy. Know that if the Alzheimer's Association can be of assistance to your constituents, we are available 24/7, 365 days a year. I will send you Alzheimer's Association contact information to also include in your post. Both of our asks this year support families caring for a loved one at home. Fund $450,000 for Alzheimer's grants that provide respite assistance to Missouri families. HB 10. Pass HB 1885, the Structured Family Caregiver Act, that would offer a new option under Medicaid to receive care at home from a family member. Together, we are making a difference. Thank you for being a part of Memory Day.